Welcome to Chapter 1, EMS Systems. Alright, so these next few slides are the National EMS Education Standard Competencies. They're basically a listing of standard competencies that will be listed at the beginning of every chapter. They've been set by the National Highway Transportation and Safety Act, and basically they're competencies that you should be learning at the end of each chapter. You should be able to know all of these standard competencies. So instead of me reading them, I'll just let you guys flip through these first few slides on your own. So for an introduction, obviously the textbook that you have is the primary resource for our course that we're taking, EMT here. And a couple things we'll be going over is, for this chapter, is that EMS is actually a system, and we're going to learn some of the components that go along with it. And Chapter 1 specifically discusses the system's key components. So the course description. First of all is the EMS system. I'm not sure where everybody is in their knowledge of the EMS system and how it works, so we're going to start from the very ground up. It basically is a team of healthcare professionals that are out there working together. It provides emergency care and transportation of the sick and injured individuals around your community, and it's definitely governed by the state laws. So this course specifically is going to train you to be an EMT here in the state of Georgia, and you'll actually be getting a state certification at the end after you pass the final exam, and you'll be passing National Registry as well. Georgia State uses the National Registry of EMTs as a testing system, and then from that you can get a Georgia State EMT as well. After passing the exam at the end is when you're eligible to apply for licensure. And then with that National Registry license, you can virtually take it to almost any state. Most states have 4 levels of training and licensure, and those are EMR, EMT, Advanced EMT, and Paramedic, and I'll break those down over the next few slides. So EMR, which is Emergency Medical Responder, has very basic training. And they basically provide care before an ambulance arrives, and they actually may assist within your ambulance. And some companies use an EMR as their driver as well. It's the previous licensure of a first responder. EMT has training in BLS, or Basic Life Support, and that includes things such as the Automated External Defibrillator, the AED, some airway adjunct insertion, and medication assistance, and we'll learn that throughout the course too. The Advanced EMT has training in Advanced Life Support, or ALS, and that includes such things such as intravenous IV therapy, and administration of certain emergency medications. So the paramedic has the most extensive ALS training of the different levels, and that includes things like endotracheal intubation, emergency pharmacology, cardiac monitoring, and some other advanced techniques. So our EMT course includes 4 separate learning activities that we're going to do throughout the course. First is reading assignments, some lectures here that we'll be doing online, and discussions that we'll be having in the classroom when we do our labs. Secondary will be step-by-step demonstrations, and this is where you do skills, hands-on skills, demonstration of different skills. And then number 3 is the summary skill sheets, and that's where you'll actually be evaluated on those skills. And then number 4 is case presentations and scenarios, which I'll present to you a real-life scenario in a training situation, and you'll complete it. So EMT training, some focus and requirements. Basically EMTs are the backbone of the EMS system. Dispatch sends them out first. They're the first out there, the first responders, if you will, to get on scene. They're calling for advanced ALS care if needed, and sometimes they're the only ones available, so they're doing the work on their own. Basically, they provide emergency care to the sick and injured. And some of the patients that you see are actually in life-threatening situations, and some of them are absolutely not, and they only require some supportive care. So you'll see a large, diverse group of people from completely sick to not at all. Some of the subjects that we're going to discuss are scene size up, which is what you do to assess the scene. You look at it and you look for hazards. You're trying to get a basic understanding of what the scene that you're about to present into is like. And then obviously there's patient assessment, which is your skill at observing what the patient is actually going through, looking at them, listening to them, feeling different parts and such. Then there's the treatments, which you'll learn what to do as a treatment based upon what the patient's condition is. Packaging is the term we use to get the patient ready to transport. So that could be on a backboard, it could be in a stair chair, it could be just on a stretcher, sheet drag, all kinds of different ways. And then we'll be looking at EMS as a career. Some people just use it as a stepping stone to go to the next part of their desired career, and some people plan for EMS as an actual career. And there's a big difference there. So for licensure requirements, the requirements differ from state to state, but the general requirements to be an EMT are a high school diploma or the equivalent thereof, your proof of immunization against certain communicable diseases, and each state has a little variance there, and then you have to have a valid driver's license that can't be revoked. It's got to be active and valid. You'll also have to successfully complete the BLS or CPR course, which I'll most likely be the one teaching you that right here in the classroom actually. And then you'll have to do our state approved EMT course, which is what you're enrolled in. That's what you're going to be taking. The state recognized written certification exam, and that's at the end of the course. You'll take the state test, and then you'll also have to do the practicals. And part of those is National Registry, because they have a written and a practical for National Registry as well, and you'll use those to get a state certification. So it might seem a little bit confusing for now, but it'll make sense in the long run. You test through National Registry to get a state certification. So some additional licensure requirements are you'll have to demonstrate that you can meet the mental and physical criteria necessary to perform the job of an EMT, and you'll have to maintain compliance with other state, local, and employer provisions based upon where you're being hired. Something else to be aware of is the Americans with Disabilities Act, or the ADA. It guarantees disabled individuals access to state and local government programs, and it prohibits employers from failing to provide full and equal employment to the disabled. So any employer you're going to be trying to get a job with as an EMT also is an equal opportunity employer and ADA compliant. Now let's get into the overview of the EMS system. For the history of EMS, our origins date far back to the volunteer ambulances that were in World War I. And then additionally, we had field care that was in World War II, and beyond that was the field medics and the rapid helicopter evacuation in the Korean conflict. That's where my job came into play. The helicopters started actually transporting sick and injured individuals out of the war zones. So EMS started in the military, and we just have transferred it into the civilian sector over many, many years, and it's been modified for the civilian use. So EMS as we know it today originated in 1966 with the publication of basically a research document that was called The Accidental Death and Disability, the Neglected Disease of Modern Society. And it basically revolutionized the way that the country as a whole and EMS as a whole responded to emergencies involving whether it was medical or trauma. And it really set the standard on how a response should happen. And then the DOT published the actual first EMT training curriculum in the 1970s. And I know that sounds kind of weird, but it was actually the Department of Transportation that started its first EMT curriculum. So after that, the American Academy of Orthopedic Surgeons prepared the very first EMT textbook to follow that curriculum set by the DOT. This happened in 1971, and it was known as the Orange Book. Now the textbook that we're using is the 10th edition of that very same book. So it all originated from the DOT's curriculum set by the AAOS in their textbook. So now efforts are underway to standardize the levels of EMS education nationally, and the National Registry of EMTs is leading the way on that. So let's look at some levels of training. First of all, you've got the federal level, and that's where the National EMS Scope of Practice model provides guidelines for the EMS skills. So they set it at the federal level, and then it trickles down from there. At the state level, there's laws that regulate your EMS provider operations within your state. And then down at the local level, you've got a local medical director that's going to decide what you can and can't do from day to day. He's going to set your limits on the EMS personnel and the people that he or she is the director for. Now, each one has to stay within the above one. So at the local level, you can't be doing things that the state won't allow, and at the state level, you can't be doing things that aren't allowed at the federal level. So it trickles down each one. So this is a graphic of the hierarchies of the National EMS Scope of Practice Model. As you can see, you've got the medical direction circle, you got a state EMS office circle, and you have a national EMS circle. Each one has their own area of responsibility, if you will, and they do overlap each other. So sometimes you deal with the state and federal level, sometimes you deal with state and local, sometimes you deal with all three. They do overlap each other. Public BLS and immediate aid. There are millions of lay people that are trained in BLS or CPR. A lot of them have to have the training for their jobs. Anybody that works at a regular hospital or a doctor's office or a school or an airport, most of them have been trained in CPR. So you got teachers, you got coaches, you got child care providers, and all those. And then you've got people who regularly accompany groups on trips to remote locations. So if you're going out somewhere like the Boy Scouts, for example, they take their own medically trained folks out with them too. And then the AEDs, which we have in the communities, are made to be used by lay people. They're automated external defibrillators, one button operation, sometimes two button operation, but they're made to be used by lay people. So everywhere you go, there's going to be somebody out there who can help to a slight bit. So let's look at some emergency medical responders that are in the communities. We've got law enforcement officers, and although they are being called for law enforcement reasons, they are trained in first aid, CPR, and such. So they can be emergency medical responders. Obviously, firefighters. Here in our city in Columbus, our firefighters are also EMTs and paramedics, and a lot of cities in the country use their fire services for their EMS as well. Park rangers are medically trained individuals. Ski patrollers are medically trained, and then all of these emergency medical responders are going to initiate any immediate care that's needed, and then they'll also readily assist you and EMTs when you arrive. And then here in America and other countries, I don't mean to say it like that, but there's good Samaritans all around you that are trained in first aid, and they're trained in CPR, and they'll show up at a scene, and they can provide you a lot of valuable assistance, even just picking things up. Hey, go do this. Hey, call 911. Hey, whatever. They can help you. But you got to be wary because they can also interfere with your operations, and they can put themselves in danger or others in danger without even knowing that they are. So as far as EMTs go, the course usually requires about 150 hours, and it changes based upon the state standards that you're going through, but it's about 150 hours per each one. And the EMT has knowledge and skills to provide at the basic emergency care level. And upon arrival at the scene, the EMT assumes responsibility for the assessment, the care, the packaging, and the transport of the patient. You are responsible. So we will learn how to do it quite well. You'll be very efficient by the end of the course. So looking at the advanced EMT, the advanced EMT course takes the EMT and adds to it the knowledge and skills in specific aspects of ALS. And that includes IV therapy, advanced airway adjuncts, and some medication administration. And moving on to the paramedic level, that's an extensive course of training. That's going to be 800 to 1,500 hours or more. A lot of places now offer it with the associate's degree in EMS or a bachelor's degree program in EMS. And it includes a wide range of ALS skills. So there's 14 components that they've labeled within the EMS system. First is public access, and then you've got communication systems, you have clinical care, human resources, medical direction, you have legislation and regulation, you have the integration of health services, evaluation, information systems, system finance, education systems, prevention, public education, and finally EMS research. So these are the 14 components of the EMS system, and over the next few slides we'll break down each one and look at how it works. So this is a graphic representation of the EMS system. In the center you see some of the different components that we just talked about, and then going around the outside it starts on the top left with the blue public education, educating the public on how to use 911. Then there's an emergency, and they have the top right would be incident recognition, where somebody says, hey, help, we need some help here. They'll access 911. That'll lead them to dispatch. Dispatch will send out the first responders or BLS or ALS, depending on who's appropriate for the call. And then after they arrive, they'll be doing the transport, whether it goes by ground or air, if you're far from the hospitals. And then from there, the transport goes to the emergency department and local facilities. And then if the patient needs it, they'll receive specialty care, and they'll receive patient rehab or recovery. And then you move back into helping that patient prevent and be aware of how to prevent next time, and then it leads back to public education. The circle goes round and round. So public access is the first component, and the 911 system is set up for easy access to help when there is an emergency present. And the 911 system is a public safety access point. That's where they are calling 911 to get help. And it didn't used to be like that. It used to be where they would have to actually phone the individual police station or fire station or call a specific dispatch phone number. So 911 has really revolutionized the access. So the second part of dispatch is EMD, emergency medical dispatch, and that is basically where the caller is given medical instructions until EMS arrives. They'll have them, perform the Heimlich or start CPR or lay the person flat or sit them up or put them on their side. And there's a lot more to it than that, but those are just some basic ideas of how EMS dispatch will actually filter the call and give initial care over the phone. It's pretty impressive. So next is the communication systems. So from the caller's information that they give when they call 911, dispatch will flip through their EMD chart and they'll select the appropriate part of the emergency system to activate. And that'll be your EMTs, your paramedics and such. And then depending on where you're at, that EMS may actually be part of the fire department, part of the police department, or a completely independent ambulance company, or a combination thereof. So we have new technology recently over the past few years that helps responders locate the patients. They used to just give you like an address and you had to find it on your own. But now cellular telephones and 911, E911 has people's addresses listed where it has GPS coordinates. They have mobile data terminals that go in your ambulance, and your ambulance gives you GPS guided directions straight to the call. So it's pretty impressive stuff. So the next EMS component is clinical care, and for the clinical side, it describes the pieces of equipment that you'll be using, the medical equipment, and it also gets into the scope of practice, which is your list of things that you can and cannot do for using each one of the equipments that we carry on the ambulance. So the clinical side also familiarizes EMTs with the ambulance controls, how to operate them, fueling operations, pneumatic ranges and such, operation of the different systems within the ambulance. And then it teaches also where your primary service area is, or your first response district, depending on where you're at. They'll call it different things, but that's all within the clinical side. So the next component is human resources, and just like many companies, human resources focuses on the people who are doing the job, who are out there, in this case you're delivering the care. So they take care of your compensation, they help interact with other members of the medical community, and they're all about your well-being. And efforts are underway to allow EMS providers to move from state to state, and I mentioned that earlier. National registries involved with a lot of different HRs and city and local governments to try to allow reciprocity for EMS providers to go between states with their licensure. So next is medical direction, and the physician medical director is going to be the one that authorizes EMTs to provide the medical care in the field, and that appropriate care is described in standing orders and protocols. And basically, standing orders and protocols are the written ones that we operate off of on a day-to-day basis, and they're all approved by the medical director or written by him directly or her. So medical control or medical direction, interchangeable there, they can be either offline or online. So you got offline medical control, which is also known as indirect, and that's your standing orders, your training that you've been through, your supervisors, written protocols. These are things that are set on paper for you to follow. And the next thing is the online style or direct communication is where your physician actually gives directions to you via phone or radio. And the best way to do it is either call on the radio or call dispatch and have them patch you through on a recorded line. That way everything's recorded. So the next component is legislation and regulation, and that includes the training and protocols and make sure that your practice follows state legislation, just like the federal and the state and the local, like we talked about. There's senior EMS officials. They handle the administrative tasks such as scheduling, personnel, budgeting, purchasing, vehicle maintenance, and I'm sure there's a plethora of more components that person's responsible for. That all happens behind the scenes going on so that you can ride on a daily basis and just go out and do your shift and take care of people. Next is your integration of health services. You got pre-hospital care that's provided by an EMT, and it's coordinated with the care that's going to be administered by the hospital. So your care prepares the patient to be cared for by the hospital and the ER staff, to be admitted to the hospital, to be set up for follow-up with orthopedics or neurosurgery or wherever they need to go. So it's the overall integration of all of the health services available to that person. So the care simply continues in the ER and then through it to the next place. And it basically, this whole system ensures that the patient receives the comprehensive continuity of care that they need. The next component is evaluation. So your medical director is overall responsible for maintaining quality control within your EMS system locally. They have continuous quality improvement that they do. They do reviews, they do audits of your calls, audits of experiences you've been through and such. There's refresher training or continuing education. Those are important. We do those annually. We do them quarterly. Your licensures every 2 years, 3, 4 years, depending on what license you have and where you're licensed through. And all of this evaluation is basically set up to minimize errors. That's the goal. Minimize errors, improve the system, make it better. Another important component is information systems. So information systems, IT, basically, it's used to document the care that's provided. And once it's stored electronically, it can be used to improve the care. That's where they're going to get their review from. And the information systems can help determine basically the average on-time call for trauma patients. They can track down to the very second when you got to the patient, when you got them to the trauma center and such. And they can also determine the need for educational sessions by reviewing your charts and such. And then they can look at the entire nation through the reporting systems and find trends of different medical events, trending on response times and all kinds of data that they can pull from it. Now you have system finance. So finance, just like many other companies, is obviously financially responsible for their system, making it run with the money. Finance systems, they vary depending on the organization involved. So here in this table, you see a different setup. You've got private organizations, you got hospitals, you got public utility, public safety, law enforcement, several different ones. The fire department, I skipped that. Basically, each setup of EMS is going to have its own financial background. Some are privately run, some are publicly run by the government, and it just depends on which one you get into. But basically, finance is financially responsible. That makes sense. So within the finance system and whatever system you're in, the personnel may be paid. They could be a volunteer department. It could be a combination thereof. And then your EMTs may be involved with gathering insurance information. Sometimes the hospitals do that for you and they share it with your company, but a lot of times you got to ask outright for the person's information so that your company can bill them. And then some ambulance services are fundraisers. They use fundraisers to raise funds publicly. And then sometimes they have other activities to secure finances like raffles or, like a levy. There's other ways too. Next is the education systems. So EMS instructors are licensed in most states. Some states don't require that, but most of them do. ALS training is provided at a college or adult career center like Columbus Tech, CSU, or Trinity EMS for us. We're an adult career center. Or the hospital settings. A lot of hospitals do their own ALS training. Continuing education is needed to update knowledge and refresh skills. And like I said earlier, continuing education it is what it is. Continuing. It's quarterly, it's annually, it's biannually. It happens all the time. It's always going to be there, so just embrace it, learn what you can, move on and learn the next thing. So now you have prevention and public education. They go hand in hand. Prevention and public education, they're two components of the EMS system that focus on public health. So here's a little table that with some examples of public health and what they do. So with prevention and public education, the emphasis is always on prevention, and that happens two ways. First of all, EMS works with the public health agencies these are the two different ways. They are primary prevention, which is to prevent something from ever even happening, like vaccinations and such. And then the secondary prevention is when it's already happened. They try to decrease the effects of the event, such as like helmets and seatbelts, things like that. So looking at the research component, the research helps determine the shape and the impact that the EMS has on the community. And the EMTs may be involved in research through gathering data. And you've also got a component that's evidence-based decision-making is based on research. So all of the decision-making that we do on the job is based on somebody else's care that we did research on and have decided this is the best way to do it now. Let's look at some roles and responsibilities of the EMT. First, you got to keep your vehicles and your equipment ready for an emergency. You got to ensure that yourself, your partner, and your patient and bystanders are all being safe. And then you need to be able to operate an emergency vehicle safely in the public sector. And you'll obviously be an on-scene leader. Now, at first, it's a little intimidating. Not many people come out of the gate as a leader, but you will learn how to be the leader on the scene. It's very important. You'll also be performing an evaluation of the scene itself. You'll be calling for additional resources if you need them. You'll be gaining patient access, so will the fire department, so will police, but that basically happens. And then you'll have to perform patient assessments, and therefore after that you'll be doing your care. So here's what I was saying. You'll be giving emergency medical care to patients while awaiting the arrival of additional medical resources, or you'll be doing it on your own. And they want you to only move patients when absolutely necessary to provide life, to preserve life. And sometimes that changes a little bit. And then another responsibility is to give emotional support to the patient, the family, and other responders. You will also be responsible to maintain continuity of care by working with other medical professionals. Most of the time you'll be picking people up in the public, but sometimes you pick them up from a doctor's office, and sometimes you drop them off back to a nursing care facility. So there's a continuity of care between where you're taking the patient from and where you're delivering the patient to. You'll also be resolving emergency incidents. When people call, it's an emergency for them, but don't let it be your emergency. You'll have to uphold medical and legal standards, and you'll learn those throughout the course here. And then you need to ensure that you protect the patient's privacy, because everybody has the right to privacy as well. There's a lot of roles and responsibilities. This is the last one. You'll be responsible to give administrative support. You'll be responsible to constantly continue professional development in your own career or your own timeline that they'll set you up on. Just maintain a positive professional attitude. You'll be cultivating and sustaining community relations in your own community where you work, and then that will allow you to give back to the profession itself, make it better for the next people that come behind you. Let's look at some professional attributes such as integrity, doing the right thing all the time, even when nobody's looking. Empathy, understanding somebody's current situation and empathizing with them. having self-motivation to do your training, to do your truck checks in the morning, to be self-motivated and not have to be told to do everything and micromanaged. And then there's general appearance and personal hygiene. Keep yourself looking clean, keep yourself looking professional. The guy on the left there looks like he's ready to go to work. The guy on the right looks like he just finished 24 hours. Sorry. He doesn't look as professional, obviously. So other attributes are self-confidence and being confident with your skills that you have, that you can do the right skills at the right time. Speaking of time management, it's very important. You have a limited amount of time and a set order of things you need to do, like airway, breathing, circulation. We'll get into that, but effective use of time. Communication skills are very important. You need to be able to effectively communicate with the patient, your coworkers, the hospital, the staff you're picking patients up from. A lot of different diverse communications happening. Teamwork and diplomacy, that happens with you and your partners. Make sure you're appropriate with your teamwork, and then having respect and just general respect for everyone involved, the patients, the family members, your partner, the people around you in the community. So another attribute is going to be you're going to become a patient advocate. You're going to be the eyes, ears, and voice for the patient that you're taking care of. Also, you need to ensure that you've given careful delivery of your care, appropriate delivery of your care too. And every patient's entitled to compassion, respect, and the best care possible. I try and treat my patients as if they're family and respect every single one. Sometimes they don't give that respect back, but that's a whole other story. So as healthcare professionals, EMTs are bound by patient confidentiality. So you'll need to be familiar with the requirements of the Health Insurance Portability and Accountability Act. I'm not sure you need to remember all the words, but basically HIPAA is what you'll hear it as, and it's an industry standard for patient privacy rights. HIPAA. Remember HIPAA. You will know it well. All right, so that's chapter 1. Now we're going to go through some summary slides. Basically, to summarize, we've got EMS standards are governed by state laws. The EMS ambulance is staffed by personnel that are trained to one of the 4 levels: EMR, EMT, advanced EMT, or paramedic. The EMR, they provide care before an ambulance arrives and or performing care while the ambulance is there and helping. The EMT has training in BLS or basic emergency care skills. The advanced EMT has some ALS training, and the paramedic has extensive ALS training. So after your scene size up or your initial assessment of the scene, that's when you're going to be providing care and doing the transport. The National EMS Scope of Practice model provides your skill guidelines, and we'll go over that in class. I'll show you a piece of paper that basically outlines all the skills and treatment that you can do. And you can't go outside of that. And the EMS agenda for the future includes the 14 components that make up the EMS system, and we went over those 14 components. The EMT has certain roles and attributes to reduce suffering and pain and mortality of the patients that you'll be taking care of. You may not be wonderful at the job at the beginning, but it's just like any other job. You learn it as you go, and you'll get better as you go. And the more you have a passion for this, the better you'll do at it. And I think that goes with any job. So present EMT courses provide information needed for certification, and that's what you're going to get through this whole course is certification, because you're all going to do well, and I'm going to be here to help you. So commit to continued learning. That's part of ongoing EMS education. Learn the next thing, do it well, and then learn the next thing. Always challenge yourself to learn more. And the EMT is bound by HIPAA. There it is, HIPAA, Health Information Privacy Act, and its effects on patient privacy. So we'll go over it more in depthly, but basically it says everybody has the right to their own privacy. So at the end of each chapter, there's 10 review questions. I think it would take longer for me to read them all to you than for you guys just to flip through the next 10 questions, answer them before you go on, and then look at the breakdown. Each question gives you a breakdown of A, B, C, and D, tells you why, it gives you rationale on why it's right and why it's wrong and such. So flip through the last 10 questions, and then that'll complete the chapter.
Credits: Chapter 1, Mark C. Ide. The background slide images are from Jones and Bartlett Learning. Narration by Aaron Hiscox.